So good day po, ma'am. So here we are the group 5 and we'll be talking about the drug liberation and the bioavailability. So here we will be talking about and we will be sharing our insights about this topic. So uh, we are Rashid, Hindawi, Tejada, Cañada, and Alango. So here are the topics. So this section will be defining the liberation, and we'll be talking about the factors that may affect the liberation, what is the bioavailability, and we will be differentiate the absolute and relative bioavailability and the bioequivalence and therapeutic equivalence. So that at the end of this session, we'll be summarizing what we've learned. So the liberation of drug.
So in pharmacokinetic process, we have these steps that composes the process in pharmacokinetics. So the first one is the liberation, the second is the absorption, third is the distribution, and the fourth is the metabolism, and the last one is the excretion. So liberation refers to the process by which a drug is released from its pharmaceutical dosage form. The liberation phase is one of the key steps in pharmacokinetic profile of a drug and is often the first step in the process. It involves the breakdown or dissolution of the drug from its dosage form, which can vary depending on the drug's formulation. The efficiency and speed of drug liberation can significantly impact the overall pharmacokinetic of a drug, as it determines how quickly the drug becomes available for absorption. Factors such as the drug's formulation, solubility, and the presence of excipients in the drug in the dosage form can influence the liberation process. After the liberation, the drug can proceed to the absorption phase, where it enters the bloodstream and begins to exert its therapeutic effects. Understanding the liberation kinetics of a drug is important in drug development and formulation, as it can affect the drug's bioavailability and ultimately its effectiveness in treating the intended medical condition. So the other process of pharmacokinetic is the absorption, which describes how the drug moves from the site of administration to the site of action. So the distribution describes the journey of the drug through the bloodstream to various tissues of the body, while the metabolism describes the process that breaks down the drug. And the last one is the excretion. It describes the removal of the drug from the body.
So for the next one is we will be talking about the factors that may affect the liberation. So at first is the surface area. So drugs are more liberated when the drugs are in small particle size with a larger surface area. So these small particles are considered as finely powdered, or those drugs um, that has small particles, and they also have a large surface area in which it enhances the drug's solubility and how they disintegrate into our body. So that is for the surface area. So the next one is the pH. So in acidic pH, it enhances the liberation of weak acids, so making them dissolve more readily. So for example, here is we have a aspirin. So aspirin is a weak acid. So it readily dissolves and thus in our stomach. So our stomach, take note, has a low pH. So it hydrochloric acid. So we conclude that the low pH conditions which is our stomach, is much favorable for the dissolution and the liberation of drugs that are also low pH or acidic in nature, like what I've discussed, which is the aspirin. So the next one is the alkaline pH. So this alkaline pH, it promotes liberation of weak bases. So weak bases to improve their dissolution. So for example, here is the calcium carbonate. So this dissolves more readily in the small intestines because our small intestines, our small intestines pH is neutrally alkaline. So closely alkaline siya. So we then conclude that the alkaline pH of our small intestines enhances the liberation and dissolution of the weak bases medication like this calcium carbonate that I've discussed. So in general, that pH can affect the solubility and the ionization of drugs in which the acidic drugs like the aspirin, uh, the weak acids that I've discussed is much more soluble in the low pH environment, which is our stomach, and drugs that are alkaline drugs or the weak bases are much soluble in the higher pH. So for the next one is the drug design. So this is one of the factors that may affect the liberation because um, it involves some drug excipients and coatings and matrix system. So, for example, here is the our enteric coating, or this is intended for our stomach. So, this kind of drugs are designed for para sa ating sa ating small intestine. So, if na-intake natin to, hindi pa ma hindi pa madi-dissolve sa ating stomach, but madi-dissolve siya more into our small intestines. So this is one of the excipients, and we have also some sucrose, some starch, and other excipients. So for the next slide is the bioavailability.
So bioavailability refers to the percentage of a drug that reaches the systemic circulation in an unchanged or active form after administration. So it refers to the portion of a substance that enters the bloodstream when introduced into the body and is available for its intent, action, or effect. Also, it measures how effectively the substance is absorbed and utilized by the body, considering the factors such as the route of administration, metabolism, and other physiological process that can affect its absorption and availability for use. Also, maximizing bioavailability is important in fields that like medicine and nutrition to ensure that the desired effect are achieved with the least amount of substance. That's all.
So we are going to differentiate what is absolute bioavailability and relative bioavailability. And absolute bioavailability, it is when a systemic availability of drug administered orally is determined in comparison to its intravenous administration. So it is the amount of drug from a formulation that reaches the systemic circulation relative to an intravenous dose. The intravenous dose is assumed to be 100% bioavailable since you are injecting the drug directly into the systemic circulation. So in relative bioavailability, it is when the systemic availability of drug administered orally is compared with that of an oral standard for the same drug. Like for example, Brian suffers from breathing problems when he plays football. The doctor would like Brian to be able to treat future asthma attacks himself. He therefore considers giving Brian either tablets or an asthma spray. It is both containing the same active substance but in a different form of drug. So the next. bioequivalence and therapeutic equivalence. In bioequivalence refers to the biological similarity of two or more drugs that have the same active ingredients and desirable patient outcomes. For example, it is comparing two brands of paracetamol for their bioavailability. If two drug formulations have same bioavailability and rate of absorption, they are bioequivalent. And in therapeutic equivalence, it means that two or more drug products with the same therapeutic active ingredients have the same pharmacologic effects and can control the disease to the same extent. For example, meperidine hydrochloride versus morphine sulfate, it is for the treatment of pain. And also the paracetamol and ibuprofen, it has two different drugs producing this similar treatment response. It is using for the reducing temperature or for fever. And like meperidine and hydrochloride versus morphine sulfate, it is for the treatment of pain.
So to sum up the discussion, drugs are processed differently in the body, and to ensure they are administered without their formulations and expected therapeutic effects affected, there are factors to be considered during their formulation. One is you should consider when the drugs are more liberated or easily released from their dosage form, like when they're in smaller size particle with a larger surface area, their pH is weak acid or weak base, and their drug design has excipients and coatings. And to determine where they can be administered or where they can have more bioavailability, the absolute bioavailability and relative bioavailability are used, wherein, next slide, wherein absolute bioavailability is you're gonna compare the drug's bioavailability when it's administered non-intravenously and intravenously. For the relative bioavailability, you're gonna compare the drug's bioavailability from its standard dosage form's bioavailability. Lastly, to ensure they have the same active ingredients and therapeutic effects, especially when comparing two or more drugs of the same type, their bioequivalence and therapeutic equivalence are determined. Wherein the bioequivalence, you're going to compare the drug's bioavailability, while in the therapeutic equivalence, you're going to compare the drug's therapeutic effects if they can control the disease to the same extent. That's all.
So that ends our sharing of our insights. So at the end of this session, so we've learned more about the liberation and also the bioequivalence and uh, some other uh, some other topics like the bioequivalence and the therapeutic equivalence, which is discussed in our pharmacology. But in this session, we will be just reviewing it. So I think that's all, ma'am. So thank you.